This is a case of endovascular treatment of a recurrent basilar apex aneurysm previously treated with coils using stent-assisted coil embolization with the Elvis stent. The 73-year-old female presented with a ruptured basilar tip aneurysm, which was treated with primary coiling. After making an excellent recovery, the patient followed up for a cerebral angiogram at 8 months, demonstrating significant aneurysm recurrence. This angiogram reveals the location of the recurrence, which is located at the basilar terminus. The adjacent coil mass is also noted. Transfemoral aortic access with a 6 French guide placed into the distal right cervical dominant vertebral artery. You can see the 035 wire has gone into the C1 segment, and the guide catheter is advanced approximately to the distal C2. A 17 microcatheter is now advanced over an oven 4 wire. You can see the wire approximating where the aneurysm is. The wire wants to go into that aneurysm, which explains why that aneurysm has recurred, because of the flow. Selection of the right PCA is performed with the wire, and once we have distal wire purchase, the microcatheter will be advanced, and there you can see the tip of the 17 microcatheter being advanced into the right PCA. Again, every time there's a stenting, one should get as far distal as is reasonable for delivery of the stent. A coiling microcatheter is then advanced over similar 014 wire into the basilar at this point. There you can see the coiling microcatheter being advanced into the basilar. The coiling microcatheter is being very slowly advanced into the region of the aneurysm recurrence, mostly by simple advancement of the microcatheter by itself, given the location of the basilar terminus and its symmetry. There you can see the tip now is in the recanalized part of the previously coiled aneurysm. The stent has now been advanced into the microcatheter but not delivered. A small coil has now been brought up through the microcatheter and introduced into that recurrent lobe. The stent, now you can see, is being deployed. The proximal markers, the distal markers are now exposed with the delivery wire. This stent is sort of a hybrid type device with self-expanding ability but also maneuverability with applying active force. So the device is being pushed forward as it is being unsheathed at the same time. The device has simply been deployed. It can be seen across the neck of the aneurysm, and now the microcatheter is being used to deliver coils into the space of the previous recurrence. Visualization of the tines of these stents remains an area that can be improved. You can see the delivery wire of the stent is still in place, and coil is being slowly advanced to make sure that it's stable. There is a better shot of the stent, how it very nicely is protecting the neck of the aneurysm. A second coil is now introduced because of almost no catheter kickback after the first coil. An angiogram there very nicely shows complete coiling of the recurrence with patency of vasculature.